Hey everybody, we have a very exciting live today. I am going to invite my friend, Dr. Curtis Rouanzoin. And we're going to talk about EMDR, one of my favorite treatments to help you have a better brain and a better life. And there he is. Hey, Kurt.
Good afternoon. Good to see you.
So great to see you. So everybody watching, tell us where you're from. And I'm going to introduce you again to my friend, Dr. Curtis Rouanzoin, who is a psychologist. He is an EMDR trainer. He's deeply experienced. I think you've been in the EMDR world for 30 years. Is that about right?
31, yeah.
Isn't that crazy?
Right, it is.
I always hate to think how old we are.
I don't want to.
So I titled this the ABCs of EMDR so that we could get a lot of letters in the alphabet.
Right.
And earlier this year, you taught me how to do it. I have to tell you, I'm having more fun with my patients. And, you know, fun for me is helping people get better.
Yeah.
That is what just makes me so happy. So do me a favor, tell the listeners your story, sort of, you know, like take about 5 minutes and just go through your journey on how you found EMDR and maybe like a great case.
Oh yeah, I can do it. Well, let me go back first of all and say when I got my training in clinical psychology, I was in a program, a scientist practitioner model where research, it was really one of the meccas of research at that time and evidence-based practices. And so that was my background. And this was long before EMDR came along. And so I got out and I was practicing, I was doing CBT and I was doing all this stuff that had some research base to it. And then one day, a social worker on my staff came to me and said, this was in 1991. He says, Kurt, I just went to this great workshop, this woman, psychologist, Dr. Francine Shapiro, and she did this thing called EMDR and doing eye movements back and forth, and it helps people with trauma. It was the best workshop I've ever been to. And I remember standing there looking at her like, right, good for you. I'm glad you found something that you thought was helpful. I'm a scientist. I didn't say that, but in my, yeah, this is voodoo. Well, about 6 months later, she came to me, and this woman is a good friend, and she also was very, shall I say, she was very tight with her money, and we'd go out to lunch, and I'd be the one that bought, but she came to me, and she said, I want you to go. She's coming back down to Orange County. You need to go to this workshop. I said, no, I don't think so. And then she said the magic words. Go to the workshop. If you don't think it's worthwhile, I personally will reimburse the cost of the workshop for you. And I went, wow, this really means something to her. And so I went. And of course, mistake I made was I stayed for the practicum where you practice with other people. And I did this work that something I worked on for years. It was one of my go-to things I could talk about. It was like a method acting course, where I could go to it and I get a little tear going about what happened to me when I was in third grade. But this time, when we were sitting there with my therapist who was working with me, she knew nothing about EMDR. She was reading now the manual, and I'm there and I'm following her fingertips. And all of a sudden, I began to have physical sensation related to what happened. It was an injury, and I felt it in my body. And a sharp pain went down to my neck. I never had that experience before in all the other therapies I'd done. Something was stored in my body, and EMDR was able to release that. So I went back now as the scientist, and I was stuck because I just experienced something I could not explain. And so I spent the next 31 years learning about it. The first person I ever did this on I went back on Monday to my office after that training. And I figured, oh, I'm going to work with this guy because I've been working with him about a year, 18 months. And we had a great rapport. I'd done some great systematic desensitization, you know, Joe Wolpe's thing. Do you remember that? I had done that work with him, and he'd made some significant changes. But, you know, I settled for the word functional back in those days. Someone was having a difficult time. I got them functioning, and I thought, okay, that's good enough. And the patient often thought it was good enough. But what I realized with EMDR is I can get them to thriving. It's a different place. So I did it on this patient of mine. And in one session, he had a breakthrough. And all the 12 months, 18 months we worked together, he never had. And I'm just standing there stumped about how this works. And so that began my journey, Daniel. And from that point on, I like you, people say, how can you do this work, trauma work, as long as you have? I said, I can do it because I do EMDR. I see the changes.
And people get better. So we'll step back a little bit and tell people some of the basics. So it stands for eye movement, desensitization, and reprocessing. And Francine found it because, if I understand right, she was taking a walk, was thinking about something upsetting, but found when she moved her eyes back and forth, left to right, that she wasn't as upset. And then developed, really using a lot of smart psychological therapies, actually combining them. And like you, well, maybe not like you, because I've been referring for it for about 31 years.
Yeah.
Jennifer Lendl, one of the original EMDR trainers, your friend, my friend, worked with me in my Northern California clinic, and I just saw it to be so effective. And then I published a study on police officers involved in shootings. We scanned them before and scanned them after. And EMDR changes the brain.
Right.
And so many psychological symptoms are based on past emotional trauma. You can get anxious, you can have panic attacks, you can be depressed, you can have OCD, you can have an eating disorder. And I asked you recently when we were together, you know, what's sort of the big latest in EMDR, and you told me, well, we're realizing trauma is the foundation of a lot of mental health issues.
Yes. You and I have spoken that, you know, the Bible that we have to use as mental health professional, the DSM, Diagnostic and Statistical Manual, I believe for a long time that what the DSM really is, it's a book about trauma, and the diagnostic categories are nothing but how that trauma is expressed in that particular patient. If it's a mood disorder, you're going to find often a trauma base. How it impacts the brain, right? So not only is it a brain thing, but there's a trauma thing to it. And I think that's going to be the biggest change for the next many years.
And so it started with eye movement.
Yes.
EMDR, eye movement, but it morphed into bilateral stimulation, whether alternate tapping or sound stimulation. When did that happen?
Very early on, and it goes back to our friend Jennifer Lendl. She was in her office in San Jose treating people with EMDR, and in comes a gentleman being pushed in a wheelchair who was blind. It's very difficult to do eye movements when you can't see the hands, right? And so, like many necessity is the mother of invention, right? So she's there sitting with this gentleman and figures, okay, what am I going to use? Well, what modalities are left for someone who has no sight? And that was sound or tapping. And so she began to do the tapping and the sounds and realized that, you know what? It's the bilateral stimulation, the movement between the hemispheres, that seems to be the common element in all of those. Now, most research has been done on the eye movements, but out of necessity, I've had to use the other modalities. and I found it very helpful. More research needs to be done to compare the modalities. I think that's important. But that's when it morphed. It was a necessity when someone couldn't follow the eye movements.
So generally, many practitioners start with the eye movements, but then they'll go to tapping or sounds as they need it. When should someone consider EMDR?
Well, you know, my prejudice is right now. Right now. Because I think that I've often asked the question, you know, is EMDR appropriate for this case or that case? And I tell people most of the time, EMDR is always appropriate. It's a matter of the timing, when it may be used. If I'm working with someone with an affect mood disorder, you know, I'm going to, well, first of all, I'll refer them for a scan, see what's going on, and get the background of what's happening in their brain. And then I will often, in my history taking, try to connect their moods and when their depression or their experience happened to earlier experiences when it may have occurred and create a traumatic memory. And so we'll work on those traumatic memories in conjunction with other kinds of talk therapy, supportive therapy. So,
you know, I think if someone is if somebody's taking a benzo, like Xanax, or they're seeing a psychiatrist for anxiety, or they've had significant emotional trauma, EMDR, I just think, is one of the first things to do. It's fast, it's effective. Now, of course, if you're still drinking, you should probably stop that. You know, I've been using the analogy recently because on my page, I get so much about magic mushrooms and marijuana and ketamine. And I'm like, it's sort of like magic mushrooms without the side effects. It opens your mind to process information in a completely different way. And as you taught me, what I do when I do EMDR is I help that person's brain lead us to the healing places. Can you talk about that?
Well, you know, one of the things that I tell people when they come in for either when I'm training or patients come in as part of educating them about what trauma is that most people, when they think of trauma, they think of what we call the big T traumas, war, assault, some kind of violence. But we also know today, 31 years later, that, little T traumas, the things that happen every day over and over again accumulate and can cause traumatic response. And I tell people all the time, trauma is not defined by the magnitude of the event, but by how it gets stored in the nervous system. That traumatic memory gets stored in a bubble of isolated experience, with sight, sound, smells, strong emotional reaction. And your brain is designed to heal itself. Much like you cut your finger, your physician does not heal you. They remove the obstacles that may prevent the finger from healing itself. But you leave that doctor's office, the finger continues to heal itself. Unless something comes and blocks it. It gets opened again, it gets infected again. So what happens with trauma is that it interferes with the brain's own healing mechanism. That hyperarousal prevents the brain from naturally processing that event to a state where I don't have the gut punch reaction anymore. A bad event will always be a bad event. It doesn't become a good event, but a bad event can be remembered without the gut punch. And what EMDR does is simply remove the obstacles and allows the brain, like you say, the brain to process. We call EMDR reprocesses in a way that allows that natural healing process of the brain to work. Our job is to stay out of the way, is what I think you probably found too, Daniel, is that we stay out of the way. And
because my mouth always wants to get in the way. I'm like, I'm so smart. Let me interpret this for you.
That's
and
right.
I realized, shut up and do the eye movement.
Right.
and let them connect with what's going on. People are asking, how do I find an EMDR therapist? And there's a website of the International EMDR Association, EMDRIA. .org, where you can find practitioners. For those of you that are medical and mental health professionals, Kurt and his partner actually run an EMDR training group. That's where I got trained, EMDR professional training.com, right?
That's correct.
So I will post that link, and I'm just telling you, it'd be the best investment. I mean, I am certified in hypnosis. I love that. I'm a certified biofeedback therapist. I love that. Obviously, I read brain scans, that's what we do at Amen Clinics. But I find, of all the things I know how to do, EMDR is fast and effective. Now, it means you have to do the other things right as well,
right.
Like take care of your brain, and if you have head trauma, rehabilitate that. Talk to me about a case that's been important for you, and then I'll tell my own little personal experience.
Well, let me tell you the one that probably not meant the most, but the one that always stands out to me was I got a referral of a young woman who had been a victim of violent assault. And she had been to 4 or 5 other therapists that did, CBT, talk therapy, all this. Of course, the problem was everyone wanted her to talk about what happened. And when she talked about it, rather than feel better, she got activated because the memory was stored in a traumatic way, in that bubble of isolated experience with strong emotions that hadn't been processed. And so she came to me, someone referred her to me, and she said, I'm a man. She was hurt by a man. She's sitting there and she looks at me and says, I don't know why I'm here. I said, well, why did they say that? Well, my friend said, come to see you, that you did this eye thing that might help. I don't want to talk about it. And I looked at her and I said, well, how fortunate. I don't need you to talk about it. And she says, well, what do you mean? So let me ask you some quick questions. When you think about this assault, is there a picture or image that captures the worst part of it for you? She says, yes. Can you tell? I don't want to talk about it. But if I said assault image, would you know what I'm talking about? She says, yes. I said, and when you think about that incident, that assault, is there an irrational negative belief about yourself that comes up? Kind of like ants, right? Automatic negative thoughts. And she says, I'm spoiled goods. Immediately could tell me. And the emotion, I feel shame and anger and hurt and fear. I don't care. Those are all disturbances. And I said, okay. On a scale of 0 to 10, how disturbing is it for you right now? She says it's a 10. And where do you feel it in your body? In my stomach. I said, that's all I need to know. And I taught her, I said, it's like in EMDR therapy, we don't have to use the words and you don't have to tell me all the details. And we begin reprocessing that. I taught her what it meant. We use that metaphor like scenes from a train, Daniel. You're sitting on the train, you're mindful of what's going by, you're watching the scenery go by. Well, what does that mean? Well, sometimes the pictures or images you start off with goes to other things. Just notice it. Be mindful of it. The negative beliefs may go to other things. Just notice it. The emotions may increase, decrease, go to other emotions, and where I feel it may change. We don't need to understand, explain it. We don't have to figure it out. That's the brain moving and allowing it to reprocess. So we went through 2 or 3 sessions, and she learned to say to me, when I say, what do you notice, what comes up? She said bad things. And I would say, go with that. We do another set of alignment. What comes up? More bad things. And finally, see, the train's moving, Kurt, the train's moving. And so I continued. And at the end in our 3rd session, she went from a 10 to a 0. What happened was still horrific, but she no longer felt the emotional gut punch of what happened. So she could just And she said, do you want to know what we've been working on? And I said, no, it's up to you. I don't really need to know. And she began to tell me the narrative of what happened to her because there was no more pain. It was a historical event, now in the past. It was no longer haunting her in the present. That is what I love about EMDR therapy, is that, many people in the military, first responders, firefighters, police officers, they're encouraged sometimes not to talk about stuff. And it's horrific stuff they often experience. And the good news is we don't have to put it in words for the brain to reprocess the memory. After it's been desensitized, they often can and do.
So regular talk therapy, when you bring up traumas, can re-traumatize people, and EMDR helps to go around it.
Right.
So I have so many experiences. When I first met my wife, Tana, she grew up in a crazy family. And she wrote about it in The Relentless Courage of a Scared Child. And I really liked her when I first met her. But on the Adverse Childhood Experiences questionnaire, she had an 8. And it's, okay, so here are 10 awful things that happen to children. How many do you have? And if you have 4 or more, you have an increased risk of 7 of the top 10 leading causes of death. And if you have 6 or more, you die 20 years earlier on average. And she had 8. And so one of my first presents to her was 10 sessions of EMDR. And she almost canceled her first date with me because she didn't want to date a psychiatrist. She didn't want to be analyzed. And I'm absolutely convinced that's why not only have we been together for 17 years, we rarely ever fuss with each other. And because, she sort of cleaned out the trauma closet, if you will. So that was incredibly helpful. But my own EMDR experience, 1996, I was investigated by the medical board because in the state of California, you're not supposed to do anything outside the standard of care. And what we do at Amen Clinics is so far outside the standard of care because we actually think you should look at the brain before you go monkeying around with it. That, making diagnoses based on symptom clusters with no biological data is a little wacky. And so I got investigated and I was very anxious and upset about it. And Dr. Lindell worked in my office. And so I was free, she was free. I knocked on her door. I'm like, you have to help me. I am so anxious. I am crawling out of my skin, anxious. And no lie, she did 1 session with me and I was fine. Yeah. I'm like, no matter what happens, I'm going to be fine. I can go work in a grocery store if the whole medical thing doesn't work out. And it was so powerful and so simple. So obviously that was a trauma for me. And I think most EMDR therapists would agree that EMDR is very fast on single incident traumas.
Right.
But if you grew up like Tana grew up, it may take a while. I mean, I think she actually went for a couple of years and still goes periodically because she just finds it so helpful.
People often say, how long does EMDR take? And the research almost from the very beginning, once the reprocessing begins, and that's EMDR has 8 phases. It's not just this, it's 8 phases. And the reprocessing is phase 4. There's 3 other phases before that, preparing the patient for the work to do the work of trauma. And for a singular event, from the very beginning, research has shown that 1 to 3 reprocessing session can be effective for that singular event. But then I say, what if you grew up in a home where all you experienced was trauma for the first 18 years of your life, every day, every day, every day, every day? Then I say, do the math. Instead of a singular event, you have 1,000 events. Do the math.
Right.
The good news is that when you target a few real charged traumatic memories, it generalizes so that you don't have to target every trauma. You're able to reprocess it, and it generalizes to the others so that you don't have to do all the 1,000.
So people are asking, are there side effects of the EMDR?
This sometimes at the end of a session, particularly at the beginning, people may find themselves extremely fatigued and tired because you do a lot of work in one session. You know, I tell people all the time, one EMDR session is like 4 to 6 of talk therapy. So your brain is processing, so sometimes there's a fatigue. And so we may have to decide with one client. I have some clients I have to work with them at the end of their day so they can go home and rest. Others, they can come in first thing in the morning and go right to their work. It doesn't bother them at all. So it's a case-by-case sort of thing, and you can't really figure that out until the person is sitting in front of you. But as far as anytime you deal with trauma, it's not an EMDR issue. It's that whenever you do traumatic work with trauma, it opens up the very things that have created the symptoms in a person's life. Like, say someone has an addiction. Trauma is often the source of that addiction. And so when you work on the trauma, the things that they're addicted to may rise up in terms of, intensity, because this is what they've kept, their addiction has tried to keep out of their awareness, is the trauma. So we're working on the stuff that causes them to use in the first place. So these kinds of safety measures and support systems outside the therapy room, EMDR therapy room, is very important. I don't know if that answers your question, but
It does, thank you. What about the difference between EMDR and somatic experience?
Somatic experience focuses on the body, and EMDR is a little more structured in terms of the work it does. And EMDR does have a somatic component from the very beginning. It's focused on the body, and that's what Francine focused on in the very, very beginning. But the research on EMDR seems to show that it's a little more effective, or it's more efficient. A lot of the research will say that EMDR is equally effective with stress inoculation or direct exposure, and that's true. That's true. There's some research.
But direct exposure is traumatic all by itself.
Exactly. But you got to read between the lines in the fine print, because the research does say that. But it took stress inoculation and prolonged exposure 60 to 90 hours to do what EMDR did in 3.5 to 5.
That's my experience as well.
It may be equally effective in some articles, but it's not equally efficacious.
What I find is talking about something brings it up and it helps people process it, but it often doesn't take away the charge.
Right.
And what EMDR does is it takes away the charge. And one of the first things to do with EMDR is write down 10 of the big traumas you've had, or the most important traumas you've had. And I like what you say. It's like pick the worst one first. It's like go after the big gun, because with that works, it'll give people confidence in the technique.
Yeah. The you froze for me just a little bit there, Daniel. And one of the things I wanted to say is there's some therapists will go after the earliest memory first because it's the building block. Since I've been doing it for 31 years, I'm a boots on the ground guy. And I always go after the worst first because it generalizes through the lesser ones. And once you get through the worst, all the others begin falling by the wayside of the other traumatic memories.
So someone wrote, I did a few sessions with a practitioner and didn't notice any shifts, so I stopped. And I guess, my thought was maybe try a different practitioner. Maybe ask yourself if you're ready for it. What do you think?
Yes, definitely. the problem right now that we're facing in the EMDR world is that the EMDR International Association is the one organization that monitors the standard and quality of the trainings that are out there. And so I encourage everyone that goes to an EMDR therapist, make sure they've been trained by an organization that is approved by the EMDR International Association. I've had many people come to see me and say, "Oh, I've done EMDR, it wasn't effective." And then I ask them, "Well, what really happened?" And say, "Well, I came in, they put a headset on me, and we talked." And I said, "It's not EMDR." And so then I would do a session with them, and at the end of the session, I say, "This isn't what happened when I did it before."
Yeah.
And so there are trainings out there now that are not EMDR approved, and I don't know how true they are to the model. If you stick to the model, all the research shows that the more faithful we are to the model that Francine developed and the protocol she developed, the better the outcomes.
So who is it not good for?
Well, obviously, if someone is, in a drug-induced state and they're in detox, their brain is wired, and you have to wait till they, get that stuff out of their head, their brain. But there's a lot of research showing that EMDR has been used for the treatment, believe it or not, of schizophrenia and other psychotic disorders. Dr. Paul Miller, a psychiatrist in Northern Ireland, has written a book on that. Now, the advantage he has is he has a wing in a hospital that he can have them safely do the work and monitor 24/7. But even psychotic individuals, most of the time, as you know, a lot of times the psychosis is traumatic in and of itself. So many times.
Well, and then being hospitalized against your will or
Yeah.
to take medication, it's a lot of trauma associated. Another one asked about Tourette's, and people with Tourette's have a lot of trauma because they've been teased, they've been bullied, they've been belittled. Now, I would add probably magnesium and get someone's diet healthy, right? I always think of EMDR in the context of a holistic brain program.
Absolutely.
And all right, well, unfortunately we have to stop, but we will do this again for the medical and mental health professionals. EMDRprofessionaltraining.com. I loved it. I support it. I think it's just a great way to be trained, and it's like 3 weekends. So it's not long. It'll be a great investment. And for those people who are thinking about it, I have an EMDR therapist in our Los Angeles clinic. Kurt has a practice in Irvine. What's your website, Kurt?
My website is I would send them to the EMDRprofessionaltraining.com website, because that's the one that is most active right now.
Even they can find therapists there, people who've been trained?
Yeah, we can connect them with therapists if they contact us.
That'd be great.
But the best place is EMDR International Association.
EMDRIA.org.
Yes.
Which I posted. I'll post that again.
Okay.
All right, my friend. Have a great day. Thanks for being with me. I'll see you soon. Happy holidays.
All right, Daniel. Thank you. Bye-bye.